of Research Cafe, exploring science, my journey and engagement. Brought to you by Innovation and Ideation Club. And I am your host Mayuri Saban. Today we have a truly inspiring guest, Dr. Shivani Desai, who is type 1 diabetes scientist and working currently at Serum Institute of India Private Limited. She brings a wealth of experience and expertise in the field of diabetes mellitus, clinical research, and particularly in vaccine development. Ma'am has received many prestigious awards, including Young Researcher Award 2024, and received major research grants. Ma'am, it's an absolute honor to have you today with us.
Thank you, Mayuri. Thanks a lot.
You are not visible, Dr. Shivani.
I am not visible. Okay, just a minute. Is it okay now?
Yeah, perfectly fine. It's perfectly good.
Okay. Yeah.
Hi, you're welcome. Good morning and good afternoon.
Thanks, Dr. Ajit. Thank you so much. Good afternoon. Yeah.
Yes, guys. So I think this is the last episode of our, the Great Research Cafe, and it was a wonderful journey. Last 3 months, you guys have interviewed the pioneer scientists, pioneer researchers from India and abroad. I have, seen a lot of episodes you have done, and people from ICMR, people from, USA, and, the senior scientists from the industry, and so on. I mean, a lot of things you have done in this, and I'm glad that we have come up with such a brilliant idea. My team has come up with such a brilliant idea of Research Cafe. So, I think for a series, 11 episodes are I think a good number. And I told them we should, wind up with something really great. So the only legendary Dr. Shivani can, wind up our sessions, wind up our Research Cafe with her, own interview and sharing with her journey and experiences. So I welcome you, Dr. Shivani, and I congratulate my team and you too for your, work and your, lot of achievements what you ever done in the life. So you're welcome, and thank you very much for accepting our request. Now I'll not delay the things much. I will hand over the mic to Mayuri, and best wishes, guys. Go ahead and yeah, so over to you, Mayuri and Dr. Shivani. Thank you very much again.
Thank you, sir, for your
Thank
kind
you.
words. So let's start with the personal journey. So can you start by telling us a little about your background and what motivated you to pursue a career in pharmacy and research?
Yes, Mayuri. So first of all, before going ahead with the question, as Ajit said, it is really a brilliant idea about this research cafe. So when Mayuri called me up and when she informed me about and explained me the whole thing, I was really impressed, and it is really great to be here. Thanks for the honor, Mayuri, Ajit, and Clement. So going back to the question, to start with, like my background, I'll give a little personal background initially and then the professional background as well. So I was born in a very open-minded family. My parents, Charu and Mukesh, they have always motivated me to pursue something which is whatever comes in my mind, or they were always telling me that you do something which is just not about earning money, but to earn respect in the society. And they nurtured me the way whatever I am. I'm not sure whether I'm able to do the proper justice to what they nurtured me into. And then, apart from my parents, I have a very supportive sister. She's my younger sister, Priya. Though she's younger to me, she's my mentor and she's my go-to person. So she has always encouraged me in my personal journey as well as in my professional journey. Then I did my schooling from Daman, from Coast Guard Public School, and it was a brilliant school. I'm not saying just because I studied there, but they actually taught us a lot of values of life. So it was not just about the curriculum. The teachers really went into each and every student's personal arena, and then they inculcated a lot of values. They found out where we are lagging behind, and they embossed the lifelong learnings for us. So, and if I start mentioning them individually, it will really take the whole day for me. So we can, and then I did my college from Gujarat, from Bardoli. It's a town in Surat district. And then I did my master's from NMIMS Mumbai. And while working at my first job, I was continuing my PhD from there. Finally, after my education, I came to Pune. I came to Pune when I got married to Rahul. He's my husband and who is the backbone of my personal and professional career. So, he has been always very supportive. Like for example, I'll give a fresh example. Today, when I told him that I have this research cafe to be, I have to talk there. So he adjusted everything for me. I mean, I just had to sit here and talk. That's it. So putting across the laptop, the table, and everything. So this is a fresh example I'm giving. So he's always been by my side. And his parents, his sister, Dr. Bhavna, Dr. Bharat Desai, and his sister Vaishali, they have also been always very supportive and motivating me throughout my work. And every single smallest of the achievements, they all celebrate. My whole family celebrates. And coming to the friends, of course, you guys know better how friends are than me and Ajit. So friends are always there. They have always been there, who have played a very great role in my life. And I'm blessed by few, but best of the friends. So Supratik is my childhood friend, and he have always been there whenever I had any personal crisis. And then my husband Rahul, he also has fantastic friends who are now my family friends as well. Neerav, Kaushal, Mansi, Janak, they all are very like a family to us. They are family to us, and they have always encouraged and supported us throughout the life till now. And I'm sure the journey will continue the same way. Now coming to the question, like how I ended up into pharmacy. So as a child, I used to think about many, many options. I mean, everybody, like you also, like all the students out here, you all would have also thought, ki, I'll become this, I'll become that. But for me also, it was the same thing. But I was not sure exactly what I wanted to do. Gradually, I started with my eldest cousin. She's an engineer, so I thought, yeah, I'll also become engineer like her. She's very, very brilliant. So then I thought about engineering. Then I thought about becoming a doctor. Then I thought about becoming a space scientist and lot of things. Pharmacy was not there in the list back then. When I was in ninth grade, I got to know about pharmacy. What is pharmacy? It is a paramedical field. I got to know about pharmacy and physiotherapy also. These two fields I got to know when I was in ninth grade. Before that, I had no clue about it. Then I had finalized when I was in 11th grade. I finalized that, okay, I'll go into medical. So I have no shame in saying that I could not get into medical after my 12th standard. So I had chosen pharmacy. Of course, pharmacy was not my first choice back then. But now when I think about it, like how different my life could have been if I had chosen any other thing, may it be medical or any other thing apart from pharmacy, I feel that whatever happened for the good. This is the best, this is the best option I think I could have ever gotten into. Then doing my bachelor's of pharmacy from Bardoli. It's a small town in Surat district. So after that, I ended up in NMIMS, that is Narsee Monchi Institute in Mumbai, where I did my clinical pharmacy. So I'll take if with your permission, Mayuri, can I take 2-3 more minutes to describe my story about my
Yes,
clinical
sure.
pharmacy?
Yes.
Yeah. So when I was into final year B Pharm, everybody, all the friends, family, friends, relatives who are into pharmacy, they used to tell me that what I want to do. I was always interested in doing clinical pharmacy. So there were two options which I was more interested, clinical pharmacy and pharmacology. So both, I was like, I'm open to both. Then after giving the entrance exam of NMIMS, I was getting admission in all of the branches back then, which NMIMS was offering. So my friends told me that no, you should go for pharmaceutics, you should go for chemistry, you should go for this, but don't do clinical pharmacy. I said, why? So they were like, no, there is no scope. Koi scope nahi hai. This typical statement which you all must also be hearing. कि scope नहीं है. But then I was like, no, I want to go for clinical pharmacy because I am interested in that. And after that, after doing clinical pharmacy, I studied 2 years from there. And then I feel now that, this was the best choice. Good, I did not hear to, of course, all the well-wishers were giving good advice for good only. But this is one advice to you all also, that whatever you feel is good for you, you do it. So this is what my dad has always taught me, that you fall down, it's okay, but do what your mind tells you to do, what you think is right for you, right? If I would have done pharmaceutics, I'm sure there was a lot of scope. There still is a lot of scope, but I was not too much into the subject. So I think I would have just done average or maybe below average, or maybe I would have failed because the interest was not there. We can study for 2 years, we can study for 5 years, we can study for 7 years, 10 years. But after that, we have to do that job lifelong. And then if the interest is not there, nothing is interesting, and then you will just keep declining in your performance also. So this was the best thing which happened to me back then. And then about the goal which Mayuri asked, so that is about, I always wanted to be a researcher. I just mentioned that I had a lot of things in my mind to become a doctor, engineer, space scientist, and a lot of other things also, dentist also at one point. But one thing was clear, that whatever field I get into, I want to make research as my life. So then when I got into pharmacy, and now when I see that, yeah, pharmacy is actually so broad, there are so many things which we can do being into this area, because pharmacy is actually connecting all the medical and paramedical fields out here. So to invent something new which can be beneficial for the society, that is my goal. It is still the goal. I've still not attained it. So let's hope we can do it.
That's nice to hear that your first sentence was that you have to do something to earn respect, not money. And I think you're achieving that. Moving
Thanks.
to
Yeah.
the next question. During completion of your PhD and masters, what were your initial career goals and how have they evolved over time?
Okay. So I think partially I've told about this. Sorry for overlapping out here, but while completion of PhD and masters, so first of all, I would like to mention that no degree is enough.
Hmm.
When we are in 10th grade, our parents and other society and teachers, everybody tell us, okay, 10th, you should get through your 10th grade, then it is fine. Then when we are in 12th, they say the same thing. Then they are like, okay, do your master's, do your degree, and then you are sorted. Then they say, okay, do your master's, then you are sorted. And now I'm telling you, even after PhD, we are not sorted. So this is because it's just not about taking degrees, it is about gaining knowledge. So if I am spending 5 years for PhD, what I am taking out of it, or what I'm gaining out of it, what knowledge I am able to get, and then how that knowledge I am able to give it back in terms of any projects, or going into detail, and coming out with something which can be really beneficial for us as well as for the society, for the patients, everybody. So no degree is enough. Gaining knowledge is a lifelong process. So this is the thing. So now coming to your question, uh, my career goal was, again, I'll tell you, that it was always to become a scientist. Of course, I was not sure what to do in my life when I was in school. Then even in my so there that was the thing. Then I got into pharmacy. Okay, one thing sorted, that okay, I'm going to be a pharmacist now. So even after becoming a pharmacist, even after doing my master's, I was still not clear that what area of research I want to get into. So then I joined academics, and academics actually helped me to understand that what exactly I should get into. Because in academics we have to do everything, because we have to teach the students. So before going to the lecture, we need to learn, we need to study, we need to study the same topic every year for going for a lecture, before going for the lecture. So and plus there is a lot of access to a lot of books, lot of material, lot of study materials, lot of journals, and the students also come up with a lot of questions. So while I was interacting with Mayuri, and when I interact with any of the students of Dr. Ajit's team, I always have this thing, okay, wow, they are so smart. And the same thing I used to feel when I was working as an academician also for my other students also. So when they come up with a question, we are bound to study about it because we cannot just give them any random answer. So before giving the answer, we have to get really deep. So over time, I got to go deep into the field thanks to my students and to the job where I was working. Right, so I got to go deep into the field, and there I was able to understand the need of the scientific world. What are the problems and what are the solutions? So I made a table. So before I started, actually I did my PhD in the inflammatory pathways, and there I realized that okay, there while I was completing the PhD thesis, I just realized that if I go deep into this, there is not much I can contribute because a lot of things have already been done. So I was like, okay, I can still change my field. So I completed my thesis and then I started working on type 1 diabetes. So initially, when I started after my master's, I thought that I'll get into IVF for research. And then slowly, I realized that okay, this is taken care of. This is taken care of. So no need to repeat things, right? Research is something where we have to find a new thing. What everybody is doing, we also do the same thing. What is the use of wasting the time and resource? So then, uh, over time, I actually thought that yeah, this is the perfect thing. So then, career goal being a scientist, I finally ended up being here. And I'm not sure whether type 1 diabetes is my last project. So again, it may change once this project gets complete.
And it was like a two-way street. You were giving the knowledge and also gaining a lot of things.
Yes.
Moving on to the next segment, that is from research to life, navigating the world of research. Coming to your current role as senior manager at Serum Institute of India, can you describe your current position and your primary responsibilities?
Yeah, so I'm really privileged to work in the Department of Clinical Research and Medical Affairs under the guidance of Dr. H. Sharma and the support from my other teammates, including Samir, Pramod, and Sunil. So we are a team of 5 people here, and as a team, we are involved in handling various vaccine studies, and so there we and among the vaccine studies, it is like it starts from designing of the protocol, designing of the synopsis, then protocol, and then implementing the protocol at various sites. So planning of the preclinical and clinical studies of vaccines we do. Then once the planning is done, that is once the protocol is done, we give that protocol to the CROs, so where they can connect to different sites, to the national as well as international sites. It depends. The site selection depends on the type of project and the country where we want to get the authorization of the vaccine. So these vaccines are our in-house vaccines. Serum Institute, the manufacturing and R&D team manufactures these vaccines, and then we do the clinical trials of this. So after planning the preclinical and clinical studies for various vaccines, we speak to the CROs, we communicate with them, and with their help, we make sure that the trials are going on properly as per the protocol at various sites. Then once the trial is over, they give us the results. We make sure that they give the data. The data management is done in a very proper way. And then we review the final report for the vaccine studies. So after reviewing the final report, then we submit it to the regulators. In India, it is DCGI, and in other countries, different countries have their different regulatory bodies. So we submit the data to the regulators at individual or at respective countries, and there it is like after submitting we have a meeting. So that meeting, it can be online, it can be offline, and in that meeting the regulators will ask various queries about whatever they have in their mind, about the data, about the procedures, about protocol. They can ask anything, and once they are satisfied with our responses, then they give us the authorization for the product. They give us the license. So that is the licensure. Now, after the product is licensed, then we prepare the study data for presenting it to other stakeholders also. Then we do those presentations of the data to other doctors throughout the country, as well as at international level also. so that the doctors are also aware. Like currently, we did the HPV presentation. So there again, once we get the approval, okay, the company knows that okay, we have got the approval. The sites will also know because they are involved. The doctors at those sites are involved in the study. But what about other doctors? So we go there, we go to the conferences and present those data. Whatever queries they have, we give the medical responses to them. And then we are also responsible for publishing our data in high impact research papers in international and national index journals. So this is a overall, in a nutshell, I've explained overall processes, what we are involved. But yes, one clinical trial will take 5 to 7 years at least. And all these things it is tough than how it sounds like. So, but yeah, we have a nice team, so we can do these things very properly. And apart from this is what as a team we do. And apart from this, I'm also involved in handling the type 1 diabetes project here. So we have not started the clinical trials as of now, but before clinical trials also there are a lot of things which we are supposed to do. So I'm coordinating with other teams in the company to get the product made initially, and then once it will be done, then we'll start with the preclinical study of that vaccine. So this is what we do here as a team.
It involves a lot of juggling, although it is remarkable, but it involves a lot of juggle. Next question. What were your key research projects during your time at the Diabetes Unit, Came Hospital Research Center? Could you share with us how this opportunity came about and how did your role there contribute to the field of diabetic research?
Okay, so I worked in diabetes unit at KEM Hospital and Research Center in 2015. So I came to Pune in 2015 when I got married to Rahul, and then I completed my PhD was still going on. I faced my Viva in 2016, in April 2016, and then for a year I was not having a job. Okay, I was not having any job. And before this, I was working in Gujarat, in Vapi. I was working there as an academician. I worked there for 5 years. So I was always, after my master's, I was working, then doing my PhD. So always busy, and then suddenly after coming to Pune, okay, first 8 months were great because, I was newly married and everything. So it was quite exciting. But then after those 6 8 months, I was like, what am I doing? I'm just sitting at home doing nothing. Initially, I was completing my thesis, so but once it was done, then I had nothing to do, and I was actually getting frustrated. So I was open to do any job. I mean, any. I was open to go for academics also. I was open for hospitals also. I was open to work in a small scale company also. I was open to work in this also. What do you say? Uh, the digital, pharma digital things, which I had no clue what it was, and still I don't know much about it. But I was like, okay, I'll learn it. So that time it was like, really. But as I mentioned in my personal journey, that my husband and my friends were really very supportive. So they were giving me inputs, do this, do that. And my husband has a friend, Kaushal. So once we had, now he's our family friend, he and his wife Payal, we are family friends now. So once he told me that one of his friend was mentioning about KEM hospital. So he was saying that they have a lot of research projects. Why don't you go and try there? So I walked up to KEM diabetes unit, and there I met Mrs. Pallavi Yagnik, and she's the head administrator for diabetes unit there. And then she interviewed me, and it was all good. Then she told me that Dr. Yagnik, Dr. Chitranjan Yagnik, he's a renowned diabetologist with whom I work later. So she's like, Dr. Yagnik is not here. You can start coming, but we'll take a final decision once he comes. I was like, I was okay to do that also. So I went there and I started working over there. And then after 15 days, as madam told me, Dr. Yagnik came, and then he met me. Then he was asking a few questions, and I was new to the field of clinical research back then because that was my first job as a clinical researcher. I joined there as a clinical research associate, and I had no clue when I joined. But then yeah, I was learning. So I started working in diabetes unit under the guidance of Dr. C.S. Yajnik. He's a renowned diabetologist in Pune and worldwide, actually, just not in India. So over there, this is how I ended up in KM hospital. So there were two major projects which I was involved in, and from which I learned a lot of things. One was Pune maternal nutrition study. So that study is going on for 3 generations, which Dr. Yagnik is doing, and from his early days of career, and now he is studying the third generation children. And there, apart from this project, I was also involved in another project titled Complications of Type 1 Diabetes. So this project, the Complications of Type 1 Diabetes, this was my friend Alma's PhD project. So I have got three very good friends from Kenya, Alma, Fatima, and Riddhi. So there, Alma was doing her PhD, and I was told by Dr. Yagnik that I should help her in her project. And I was doing it because I was getting to learn a lot of things. So there, doing that project, the Complications of Type 1 Diabetes, which was Alma's PhD project, while doing that work, I realized and I started meeting a lot of type 1 diabetic children. And there I started attending the type 1 diabetic clinics, which still happens there on Saturdays. So that time I realized that, there is a lot of gap in this, because this is a disease which is affecting the children, affecting the children, and then they have to suffer from this disease lifelong. So there was really a need of developing something, a treatment or management option for managing type 1 diabetes. And there I started in 2016. This thing came into my mind. I had no clue what was type 1 diabetes. Okay, I just knew that it is an autoimmune disease, and that it happens in children. I just knew this much because this is what we are taught in our college, right? In our curriculum. And in a curriculum, they always focus on the treatment of type 2 diabetes and not one. So I had no clue what are the treatment options, sorry, management options, and what is the pathophysiology, nothing. So then I started working on type 1 diabetes. So this is my, these are the projects which actually led me to now contribute to the field of diabetic research.
Means it was a turning point for you, KM Hospital.
Yes, correct. It was a turning point for me, and of course, Alma was giving me a lot of papers to study because she had done a lot of literature, and then she was working on the complications part, and then I started focusing on the pathophysiology, and then after looking at any of the pathophysiologies of the disease, only then we can understand what will be the treatment, right? So when you are also studying, your teachers must be teaching you the physiology part first, then the disease pathophysiology, and then the treatment, right? So it is easy for you to connect. So I did the same thing for myself also. I studied the pathophysiology, understood what is the problem, and then started thinking about the management options.
That's nice. Means what motivated you to pursue a career in academia, and how was your journey there, being assistant professor?
Okay. So, as I mentioned in my in your previous question, that at KEM Hospital I started learning about type 1 diabetes, and then I was always my first job was into academics only. I worked as assistant professor for 5 years in Gujarat before I came to Pune. So I was always, and I still am passionate about interacting with students and being into academics and teaching, taking lectures and learning from the students. So I always wanted to go for academics when I came to Pune also. But as I mentioned, I could not get enough opportunities back then. So then I joined KEM. Then I started learning about type 1 diabetes. So now I wanted to explore the disease into more detail. I wanted to deep dive into the field of type 1 diabetic research. And after a while, I gained some experience. So then even the doors were opened. Gradually, the academics and other companies and everything, they opened the doors for me that I can now join them, because it always takes some time for us to establish ourselves. But first, we have to prove ourselves. Then only we can get the opportunities. So I was trying to prove, and then gradually I got the opportunity. So I went to DY Patil Institute, and as I mentioned, the motivation to join academics were two motivations were there, two reasons were there. One is I always have been loving academics as a career, and another was to deep dive into the field of diabetic research. So this is how I went there. I met Dr. Sohan Chitlange. He's the principal of the institute. He still is the principal of that institute. So I met him, and then he said that okay, there are some interviews going to happen from the university. So you, from my side, I'm fine. So you can join if the committee also approves, then you can join the institute. So I joined I went for the interview, and then the committee was okay and okay for me to join. They are like, okay, you can now join. So then I joined the institute. So there I started in 2017 and August, it was 5th August 2017. I remember that date very specifically. And there initially I started absorbing how the college is, what are the rules, what are the systems over there. And there also I found a mentor, Dr. Asha Thomas. So I was working with her. She's a professor there in chemistry department. So she was, kind of teaching me that how to do what work. So they, apart from teaching, there were various committees also over there. There still are various committees over there. So I was working with her in one of the committees, and then she explained me how to do how to manage the different departments, on how to manage different work. And then I have a friend Atul, Dr. Atul Deshmukh over there. So even we were working in the same department. Even he was telling me that this is how you do the things out. That whole hand holding was provided to me by Asha ma'am and Atul. So there, after learning everything, after absorbing everything, then I started giving my inputs, and they liked the inputs. Then, of course, teaching was my passion, so teaching was never a problem. It was like never a challenge for me. Students also like me. I also love students, so it worked very well. Then coming to the research part. So initially 2 years I did not do anything because I still wanted to establish myself over there. So once I establish myself, then I can demand for the support from the management, from the principal about the research. So then gradually I did that. And Dr. Chitlange gave me complete liberty to explore my interest in the field of type 1 diabetes. So he helped me to collaborate with various key people in academics as well as with Serum Institute also, where my current company is. So he's also a chemistry person, but more into administration now because for many years he has been working as a principal there. Now he is the dean of DY Patil Unific Society. So there he connected me to right people, the researchers over there. And one great connection which he helped me with is with Dr. Ramesh Monde. He is my guru in stem cell research. So I met him. When I met him, I was having, a very handful of publications, and they were also not that great. They were not into like, very prestigious journals or something. But then gradually he calmed me. He started with the spelling of stem cells, literally the spelling of stem cells. He started teaching me. So whenever I used to find time from my lectures or other work, I used to go and meet him. He was sitting in another building. So back then he was the director of research at DY Patil. So he started teaching me about what the stem cells are and how I can use the stem cell therapies in type 1 diabetes. So from that day, I had two ways already bifurcated. One was to develop immunotherapy or vaccine therapy for type 1 diabetes, and another was to develop stem cell therapy for type 1 diabetes. So both these projects started running parallelly. And this is how my academic journey into type 1 diabetes actually started when I was at DY Patil. Then the best part about being there at DY Patil were students. They are the best. I got best of the students there. They are very obedient, very hardworking. Even now, they are still in touch, and I also feel accomplished. I used to feel accomplished after every lecture, and today also I'm like I have so many students around, so I'm satisfied with my career as of now also. Because the unconditional love and respect which students give to the children, to the teachers, that's the best gift one could ever have. And apart from teaching them, I learned a lot of things from my students. So I was working in when I was working on type 1 diabetes vaccine project, my PG students taught me how to, do the animal handling and how to dose the animals because my background is clinical pharmacy, not pharmacology. So I never handled animals. After doing, like, I have done so many projects, so many preclinical projects I've done so far, but I'm not great in animal handling. But they taught me, how to handle the animals, how to hold them, how to do the dosing. So a lot of other things also I learned from there. And teaching and interacting with them was my favorite time. And still, when I do, like today also, I know that what question you are asking, I think I'm giving more information than required because I really like interacting with the student pool. So that was about my journey at DY Patil.
Yes, ma'am, I have also met the Dr. Ramesh Ponde. He is very fatherly person, and every day you meet him, you will get lot of things to learn from him. He is
Yes.
very nice. Moving to the next question. Reflecting on your internships at LG Rotary Haria Hospital and Somya Hospital, how did this experience shape your career path?
Yeah, so this LG, so I did my internship in Somaya Hospital while I was in second year of MPharm and sorry, first year of MPharm, and I did internship at LG Rotary Haria Hospital when I was in my second year of MPharm, and there I did my thesis also. My PG thesis I completed from Haria Hospital, which is in Vapi. Somaya is in Sayed. So there at both the places, one thing was very common. Like when we were being with the doctors and other healthcare facilitators, that interaction with them, that further nurtured me to be more disciplined and dedicated towards my work because they were the doctors and other healthcare professionals also, like the nurses, even the ward boys, the pharmacists over there. They were always, dedicated because one, they are dealing with the patient's life, so that is the most crucial thing. And there, that interaction that taught me to be more disciplined towards the work, and just don't take anything for granted. One value, if I put 7 instead of 8, it is okay. No, it is not okay. It can change the life of a person, of the patient. So such things got inculcated there at these hospitals. And also I mean, the healthcare environment, the overall healthcare environment is such that we feel so motivated that our motivation of treating or motivation of doing something for the society, for the patients, or for anybody in the society, that motivation gets stronger. So, these were the things which I really learned from the doctors and other healthcare facilitators at Haria Hospital and Somaya Hospital also.
Can you describe a significant learning moment or challenge you faced during your internships?
Okay, so this is a tough one. Yeah. I would say every moment was a learning moment for me. I am not able to think of a specific, thing because
It's
during internships we are still, sorry.
it's long back, I guess.
Yeah, no, it's long back. Yeah, you are right. And plus, internship is something where we are still students. I was still a student back then, right? So, in fact, we are students throughout the life, but then there the tag was also a student's tag. So I am not able to think about any such specific moment, but I can say that every moment was a learning moment for me. And I learned a lot of things from my mentors and seniors back then. And about challenges also, I don't have anything in my mind right now that this was a specific challenge because I would not address them as challenges, first of all, because the success which we get rewarded now or maybe in future, it is all after overcoming the challenges. If things come on platter, the success will not be rewarded. And if there are no challenges, there is no taste of success. So challenges are the best teachers, I would say, and it provides us the opportunity to keep growing with every passing day. So there's nothing called challenges. There's always it can be replaced with the word called learnings.
Yeah, that's nice.
Yeah.
In your extensive journey of continuous learning, you have completed various courses and workshops ranging from diabetes, stem cells, clinical research, and lot more. How have these diverse learnings experiences benefited your career?
Yeah. So, as I mentioned earlier, learning is a continuous process. So now, if it is still like right now also, I always keep looking, and everybody around me, like my colleagues also, they also like every time they keep looking for new courses coming up. And I think many times I've called up Ajit also that I want to join your this course, and he starts laughing. But I actually am serious when I tell you that I want to join this course of yours. So the consolidated knowledge which we gain by these courses actually make us able to understand the subject in detail. Because if I learn only about diabetes, then I will not be able to understand the stem cell therapy or the clinical research which I'm doing right now. Right. So we need to learn all these courses, and the consolidated knowledge which we get from these courses, that makes us able to understand the subject really well in detail. So that is one reason, and this is one benefit which I'm getting in my career now. And it also helps me to understand the intersection among various disciplines. Like okay, I know the stem cell therapy. Okay, fine. I've learned stem cell from A to Z, what type of cells and how they treat, what is the mechanism, everything. On paper, I know everything. In my mind, I know everything. But how will I be able to implement it into a clinical trial if I don't have the knowledge of clinical research? So basically, the both the fields are intersecting. So this, helping this learning of a lot of courses, that helps one to understand the intersection among various disciplines. And this is directly and indirectly being beneficial for me in my career by getting into the depth of the knowledge and knowing the subsets.
Okay. So next question, you have been resource person and evaluator at many prestigious events. Can you share a memorable experience from one of these events?
Okay. When you ask about one specific experience, it really gets very tough for me.
Maybe
So,
you can share your experience and it's interesting.
yeah. So, I really don't have a selected experience to share because every experience is a new experience to me, and they are unique in their own ways. So, if you ask me, what was the favorite what was the favorite event where you went as a resource person, I will say, okay, I don't know, because every time we talk or every time we go for any evaluation also, every time we have different students, different topics, and different audience. So it's very tough. But yeah, to answer your question, as a resource person, I would say that I've given talks offline, online, starting from rural institutes to urban institutes. So every institute will have different kind of audience. We get different audience at different institutes, and this gives different experiences. So they are special and unique in their own ways. And one common thing about about my experience as resource person so far is the interactive audience which we get. So I'm blessed and lucky to have interactive audience whenever we have talks like this. And the most important thing is their intention to learn about the topic. So whatever topic I'm teaching or whatever topic I've gone to talk about, they the students and the audience, they have always shown that intention, that intent to learn, so that motivates me to talk more. Okay, so that this is the one common thing which I've experienced in almost all the institutes, starting from urban to rural institutes. And as evaluator, that this thing, being when somebody calls up or somebody texts or emails that you have to be an evaluator at this event, that time, my literally I get stressed because this is the toughest thing to do. Being an evaluator is not really easy, because when my personal experience, whenever I've gone to any such event, all the participants are really so good, and they have different skills in them. Like somebody will be great in presentation, somebody will be great in the technical knowledge, somebody will be great in the subject knowledge. So it is very tough to evaluate. But yeah, we have to evaluate. But it gets really very tough to evaluate, because with every passing year, I'm seeing the students are getting better and better, better and better. So in 2021, for example, if I used to think that, wow, the students are so great, I think now they cannot be any better. You know, uh, group than this. But next year, I found something else. So every year, the students are getting interactive, more skilled, more knowledgeable, and yeah, these are some common points which I have observed. Instead of I tweaked your question, and sorry for that. So instead of giving one example, I gave you a consolidated example. I mean, consolidated review kind of a thing.
No, ma'am, we want to hear a lot from you. Moving to our next segment, that is innovative research projects from idea to implementation. Your current research spans several groundbreaking areas, including vaccine developments and preclinical studies. It must be incredibly complex and rewarding too. What challenges have you faced in this phases?
Okay. Uh, so you rightly said that research is complex, but at the same time, it is rewarding. So when we really have a lot of like you also, when you are doing your projects, or any person, even a school going child, they also get so many projects. So they also, when we do any kind of project, we face challenges. That is bound to happen, because it will not come as a like, on the platter that okay, this is the thing and you present this. No, we have to find our own ways out of it. But when we really get even a smallest of a positive outcome, we forget about the pain and challenges. So this is the most beautiful thing about facing the challenges, that when we get the results, we forget about the challenge part or the pain part. So to your question, there were a few challenges which some of the anticipated challenges and some of the unanticipated challenges which we faced during our project of type 1 diabetes which we did. So first of all, with every project, the first question is budget approval. That is there throughout the globe, all over the world. First is budget approval. But here I would not call it as a budget approval, because my project was not delayed so much because of budget approval. First 2 years, yeah, I was writing grants to the firms, and then I was getting reject. My project was getting rejected. I was not getting grant. But finally, Dr. Chitlange, he managed to get me the grant from the institute and to start my project. So that was taken care of. Then once the project started, then we were like, okay, me and my students, we were very happy. Okay, we have got the approval. Now we will start the project. We were all set because everything else was set. We had the procedures, we had the protocol, we had everything in place. We had finalized the labs where we will do the analysis. Everything was done. And then we ordered our antigen. Okay, for that particular project, we ordered our antigen. And that particular year, there was Russia-Ukraine war. And our product, our antigen was out for delivery, and it was coming from another country. And then suddenly this started, and everything just stopped for a few days. Then they were like, okay, now we cannot we cannot supply your antigen to you on time. And we were like, okay. So that was, that evening was really, really very stressful for me. But thanks to my students, they sat down that particular evening. I think they worked the whole night, I guess, because morning 3:45 a.m. I got a message from, and which I saw in the morning after I got up, but they had texted me, ma'am, we have got the another dealer who is ready to supply us the antigen in this much period of time. So again, that challenge came, but then my students resolved it. Then another challenge I would also mention, because see, this antigen procurement we got delayed was unanticipated challenge, right? Yeah. One example I'll give you about anticipated challenges. That is about the procedures part. So if you are doing a wet lab procedure, if you are doing a wet lab experiment, or even in the clinics also, you can have anticipated challenge. You can anticipate, okay, these are the challenges which we will face, which we may face. So you should be ready about it. Like in our experiment, one of the experiments, we needed to prepare streptozotocin solution. So we were developing a model, animal model for type 1 diabetes. And for that, we needed streptozotocin solution. and we were following each and every procedure that okay, this is how we have to, this much quantity we have to add, these are the buffers we have to add, at this much temperature we have to keep, everything we were following as per the published literature. But still we were not able to make the model of I mean we were not able to induce type 1 diabetes in the animals. And then we tried it twice. I mean, we made the streptozotocin solution, we injected into the animals, but animals were not becoming uh, diabetic. Then we went to Dr. Bonde, our guru, so my students, I have four. In that batch there were four students: Prajakta, Priyanka, Vaibhav and Shubham. So, and so we five, we went to Dr. Bonde. We were like, sir, this is not happening. I don't know why this is not coming up. Then he asked us a lot of questions. We were like, yes, we did this. Yes, we did this. And then he said, when you are mixing the solution, the buffer and the streptozotocin powder, where are you mixing it? We said, in the beaker. He said, where are, but I mean, he asked that, where are you keeping that beaker and mixing? We said, normal on the table. He said, you have to put it on the ice block and then do it. So, this is a very small thing which we missed. But that because of that small thing, our experiments were failing. And then after we did that, it was all good. So all the big things we were taking into consideration, okay, this can be done, that can be done, and this small thing we ignored. So this is again a learning for me and for everybody of us, that we should not ignore the possibilities. Even a small thing can make a disaster. So be prepared for it. And apart from these, there are many more challenges, but yeah, that's fine. Everything is on place now.
This was a great example.
Yeah.
And what advice would you give to early researchers in high impact areas? Like what we should develop in the skills to work in these high impact areas?
Okay, so it is like just keep working. First of all, take care of the challenges, of the anticipated challenges. And still, even when we take care, as I mentioned in my previous example, that even after doing so much, we still missed a small step, which was a very important step, right? So even we should anticipate and be ready for the anticipated challenges, but don't get scared when things doesn't get the way we want. So keep working, not for the success, but for the purpose, right? And we can, only we can motivate ourselves. So when things are right, everybody will be clapping for you. And when things are not going right, we feel demotivated. Because when we share the stories, we share success stories, right? If you also, like when you complete your project, you will tell your friends that, "Oh, you have done this project and this is what you got." But the challenges which you faced, they don't know about it. Nobody will know about it. Day to day challenges will come. So that time we are not supposed to get demotivated. I used to get demotivated when things did not used to happen the way I wanted. And still like right now also there are few days when I get demotivated. But my husband always tells me. So my husband is like, that time also Rahul was telling me every single day that because we stay together, so one can understand each other's, feelings by their faces. So he used to tell me that he used to ask, today you had some, problem in your lab. Then I used to tell him, okay, this happened. Then he used to tell me that, when people see the success, they will not see the hardship or the negative or the failure days which you have got. So only you have to motivate yourself. And he's right. So one advice which he gave me, I'll give you, that only we can motivate ourselves. Stay motivated even when we get negative results. Okay, that is one thing. And science is all about teamwork. This is a very important learning which I have learned over years. One single person, it is almost impossible to achieve. So teamwork is the best thing. Like right now, Mayuri is asking the question and I am replying to the answers to her questions. But behind this today's cafe, this discussion, Mayuri had a whole big team who was supporting her, and I have my whole big team right from my childhood till now who has been supporting me for because of what I can talk, right? So science is all about teamwork. Right? So these two piece of advice I would like to give it to.
Yes, ma'am. Teamwork definitely makes a dream work, I can see.
Yeah.
On to next question, that is, how do you collaborate with Serum Institute of India, and how was it influenced your research?
Yeah, so my collaboration started with Serum Institute back when I was working at DY Patil. So when I started reading deep about type 1, and as I told you that my actual work about type 1 diabetes started when I was at DY Patil. My wet lab work started when I was DY Patil. So back then, I needed some guidance about the disease, about immunology, about vaccine studies, about vaccine research. So I went to Dr. Chidlange and asked him that, if there is somebody he knows who can guide me in the area of immunology, because my master's was clinical pharmacy, PhD was inflammation, specific to inflammation. And then suddenly this immunology part came. So I had a lot of queries back then. And still I do have. So, but then back then I really wanted a mentor who can, like how Dr. Bonde is my mentor for stem cell research. So for vaccine research, I wanted a mentor. And then he introduced me to Dr. Sharma, who is my boss right now. And he introduced me to him, and then this is how, and then I discussed my project with him, and then he involved his whole team, the other three guys from the team with whom I'm working right now. And then this is how the collaboration started. So I had an idea, but I needed some guidance on immunology. So I went to this team at Serum Institute, and they started giving me inputs. And then finally, we started the project at DY Patil. So this is, in a nutshell, I told you the story about how I got collaborated with Serum Institute. This was in 2019. And this has highly influenced my research, of course, because I started this project. This idea came into my mind while I was at KM in 2016. Then I started the lab work in 2018, and then 2019 I collaborated with Serum Institute, and then now at Serum Institute we are doing the same type 1 diabetes vaccine research projects. So this is how, and if also we are going ahead with the stem cell projects also here. So this is how the whole collaboration happened, and now I'm getting to now at Serum Institute I'm getting to you know communicate or discuss the projects with other teams also, and they are also giving, the R&D teams, the manufacturing teams, the QC teams, they are also giving their inputs, the regulatory team also, so they are also giving their inputs about how to go ahead with the preclinical and clinical studies of this vaccine. So yeah, it highly influenced my work, especially type 1 diabetes related work.
And you have received numerous grants for projects from developing M-health tools for pharmacovigilance to investigating CAT65 antibodies in COVID-19 patients. How do you prioritize and manage such diverse research initiatives?
So there's a very old saying, unity in diversity, right? This is specifically we use for people, but the same approach is applicable to these research projects also. There are a lot of diverse projects which I was doing and which we are doing right now. But in those diverse projects, the intention was one. That was single intention. It was common that, and it still is common to get some really good management option for type 1 diabetes. So all these projects were a subset of one bigger goal, of one bigger picture. And all these projects, out of all these projects, we were getting the answers to a common research question. So having a consolidated approach towards a research project actually allowed us to give a detailed answer to that one problem, and it is still going on. That problem or one research question, that is management of permanent management of type 1 diabetes, the reversal of type 1 diabetes. So even starting from this M Health tool or this GAT65 antibodies in the COVID patients, even you one cannot see the word type 1 diabetes in these project names or the titles, but they are actually the subset of a bigger project.
Okay.
So yeah, it was very easy to manage it because it all roads leads to Jesus, what we say, or unity in diversity, what we say. So this is that concept.
And what advice would you give to early researchers on securing funding and managing multiple projects?
Yeah, so securing funding, it was a problem for me. So yes, we really need to have some data. So before we go to the funders like DBT, DST, ICM, a lot of funding, international fundings are also there. So before we go to for the fundings, we really need to have some data with us. So we can start with small projects as early researcher or early career scientists. You can start with small projects. You gather some data at your college level, and then with that data, you write the grants to the funding agencies. And while writing the grant, one thing I have realized that you should address the gap very specifically. You should be very particular about what gap is still there. So you have to mention the problem, and then you have to propose a solution, and then you have to say that this is the gap in this particular area. So you are filling your gap, and you also have to mention how you will be filling that gap. This thing I got to learn from Dr. Bonde. He taught me how to write the research grant. And finally, he succeeded. But initially, when I was writing, this was the problem that I did not have enough data to show to them, because they cannot give us the grant unless they have the confidence in us, in our proposal. And that confidence they will gain only from the prior art research work which we present to them. So that is one thing which you need to keep in mind. And another thing is about managing multiple projects. It is all about passion. So when we get up throughout the day, we do so many activities. Forget your work and college or your studies. Apart from that, lot of activities you do, right? When you are sitting with your family, your phone is on. So that is one very common example of managing multiple tasks at the same time. You're listening to the television, you're talking to your parents, and you're talking chatting with your friends also. It happens or doesn't happen? Can you give me this answer based on your full friend circle?
Yes, ma'am, it happens a lot of time,
Yeah,
and also we
lot.
get a scolding, nice scolding.
Yeah, correct. So it happens, right? So this we are able to manage because we have the intent to do that. We want to sit with parents also, and we want to chat with friends also. So your intention is clear. So here also managing multiple projects, if your intention is clear, if your dedication is true, you will be able to manage. There is no rocket science in this. It is very simple to manage multiple projects, but only thing is you need to be interested in doing that. And sometimes what happens when you're doing project A, the problems which you face there in project A, you already know that these are the problems. So in project B, the parallel project which you're doing, you will take care of that thing. So, this way also it helps, in fact. Managing multiple projects will help you to widen your perspective also, and to widen the knowledge also.
I guess passion fuels up the things.
Sorry?
Passion fuels up the things.
Yes. Passion fuels up. It's correct.
Moving on to next question, that is the power grant from SERV mentions using hypoxia preconditioned adipose tissue derived mesenchymal stem cells. Could you explain this concept and its more potential impact on autoimmune diabetes treatment?
Yeah. So the project which you are mentioning about hypoxia preconditioned adipose tissue. So here I'll just tell you what this project was about and how it is giving an impact. So here this project is already completed now. This project we did in animals. It was a preclinical study, and there we extracted the mesenchymal stem cells from the adipose tissues, and we then preconditioned those cells under hypoxic condition. We created the hypoxia condition, and then we exposed the cells to those in that chamber. So these preconditioned cells were then injected in type 1 diabetic mice, and that those cells were then able to bring down the sugar levels. It was also able to manage the autoimmunity in the mice. So this project we completed in 2021. Yeah, and the paper is recently accepted for publication in International Index Journal now. So now this concept, basically there are two concepts involved in this. One is the stem cell concept, and another is the preconditioning concept. So when we give the stem cells, normal plain stem cells to the mice in our experiments, they do find their way out, based on the physiology or based on the mechanism of the cells, they do find out that where they have to go and correct the problem. But when we give them a push or when we show them the direction, that makes them easier to go and treat the issue in the body, right? So this is the basic concept of regenerating the pancreatic beta cell. So here, by using the preconditioned adipose tissue derived mesenchymal cells, we tried to regenerate the pancreatic beta cells. So while regenerating the pancreatic beta cells, we are reversing the type 1 diabetes in the mice. That is one concept. And about the autoimmune part, in type 1 diabetes, as we know, it is autoimmune diabetes. So there, lot of pro-inflammatory mediators are increased and the anti-inflammatory mediators are decreased. So these cells were able to manage to bring a balance between pro and anti-inflammatory mediators. So this is the basic concept. First is regeneration and second is managing the inflammatory mediators. So this is the basic concept behind this project. We can talk a lot about it, but then time doesn't allow us to talk more about it.
That's fascinating, ma'am.
Yeah.
To next question. Can you share a memorable experience or research fail that taught you valuable lessons in your journey as a researcher?
Yeah. So research fail is a very important word. So even my first project failed. My stem cell project, which we did the first time, failed. Then my vaccine project also failed. And then finally, uh, we tried, we modulated something, we changed a few things, and then we understood what is the problem. So research fail is a very important part in the research career. But then the lesson which this taught me was, we just have to keep trying. Once we didn't get the results, twice we didn't get the results, but that doesn't mean we'll just close the books and sit at home. No, that doesn't work that way, right? So just keep trying. So I can give you one very common example. As a child, when we most of us learned bicycle when we were a child, right? So that time, the very first time when we sit on the bicycle, it is not possible that we'll start driving it or start riding it, right? Initially we fall off. Then second time somebody will support, but then again we fall off. Then again, three, four times it happens. But then slowly we'll get that balance. And today we can ride anything. Two-wheeler, four-wheeler. Maybe some of you will fly a aircraft also or a rocket also maybe. So it is that, right? So same thing is in the research also. Even if it fails, just keep trying, but learn out of that failed result. So why you got the failed results? Why you did not get what you anticipated? There must be some reason, right? Like what happened in our model development project. There was one problem. So we have to identify that what is the problem, and then you will eventually get it. So learn out of the failed results, and failure is always the first step towards a success. We see this motto everywhere. So this is the valuable lesson which we get, and never get disheartened. It's okay. It's okay not to get good results. We are here to build something special, and not to get demotivated by some such small incidences. There may be you. One last thing about this is you may also find people around you who will tell you that this is not going to work, because with all good wishes they will tell you, they are your well wishers only, they will be telling you for good because this is what they think, so they are telling you. But you just have to listen to your confidence. It is okay for people to say that this is not going to work. It is okay for you not to get the good or the expected results in your first go, or in the second go, or in third go also. But you just keep doing it. It will be there. You will be there where you want to be, right?
Thank you, ma'am. That's wonderful to hear. Moving on to next question, that is, you have received multiple awards and grants. Your trophy cabinet must be overflowing. This award or grant has been, which award or grant has been the most meaningful to you and why?
So there are two such awards which are the most meaningful to me. One is the first award or the first trophy which I got when I was in fourth grade in my school. It was an essay writing competition, and we had to write about the parade which happens on Republic Day. So everybody, or it was a competition, like, at the school level. So I came home and I asked my dad that, Daddy, please help me writing this. First, I told him, write this for me. He said, I'm not given this project. It is your competition. If you want to participate, you write it. So I wrote. Then I told him, now correct this for me. I mean, you help me writing this. Then he's like, no, whatever you have written, go and submit. I'm not supposed to help you in this because this is your project. This is your competition. You are the one who's participating and not me. I felt very bad. I was like, what kind of father is he? He's not even helping me in writing this essay. It was a small essay, like, maybe as a child, it was his fourth standard, so it must be like 100, 200 words, not more than that, I guess. So then I was, very sad and angry more. I was more angry, like, that why he's not helping me in this small things. And then I was like, okay. Then my ego also came in between. Then I was like, okay, I'll go and submit whatever I have written. So next day I went to the school and it was a Sunday next day. And then whenever I went to the school, I submitted that copy. And then the results came and I got third position in that. And the first and second position were from the children from my seniors. They were from seventh grade and sixth grade. Some they were my seniors. And then I understood the importance. Then I came home and told my dad that, see, if you would have helped me, I would have got first prize in this. And then he told me that, see, if you would have got first prize, you wouldn't be happy at all because this is that would have been something which I had written for you, and not you had written for yourself. And this third prize also, which you have got, or even if you didn't had held any position in this, still you must be happy internally, and this you will remember lifelong because this thing you had written. Whatever mistakes you had done, it's okay, but you had written it by yourself. So this trophy is very special to me. This is very old. This is a very old story, but this is really a very important trophy to me. And the second most important trophy, which is really very near my heart, is the one which my students won for me. So when I was working at DY Patil, the students went for a competition. It was a case presentation competition. So we presented a case on PCOS, and we solved that case. And then they made the presentation, and then we presented it there, and the students won first prize. This was held in, I guess, I don't remember the year, 2020, 20 or 21, or maybe no, before COVID. It was 2020. It is January 2020 sometime. This was held at Bhujbal Knowledge City. So there, my students won this. There were three rounds, and they cleared all the rounds, and they made the first position. So when they came up, and they also got a trophy for the mentor. So that mentor trophy I got because of them. So this was again a very important trophy which I always cherish. And this is actually, these two trophies are there in my cabinet. I make sure that those two should be there. Others, it may or may not be there, but these two should be there.
I'm observing that you're so humble that you're mentioning all the students, all the mentors, and everybody who had helped you and also helped you to grow. It's so great.
As I said, it is always a teamwork, right? Without students, teachers are nobody. So, and students are built because of their mentors. So it's, all the people are involved in this.
Moving on to the next segment, that is, what are some emerging trends or areas of focus within the field that you find particularly exciting or promising?
So most exciting thing for me is, doing something which has never been done before. So doing something for the very first time, and we are doing that. So this thing which we have, this thing all the researchers will be having in their mind. This excitement makes them scientists, basically, right? So doing something which has never been done before, doing something for the first time is the most exciting thing. And when the goal is clear, it becomes promising too. Because if we know that this is our goal, with so many hurdles, we can still reach there. So it is a promising area. So if the goal is clear, if the dedication is there, if the passion is there, then any goal can become a promising one. So coming up with the treatment to reverse type 1 diabetes is the most exciting thing which I'm doing. And I hope that it becomes true one day. So I can say it is also promising for me, at least in this area.
It's nice to hear. Next segment, that is engagement in science, collaboration, and community. Can you share your experiences on the importance of collaboration in scientific research and how young researchers can effectively build and maintain productive research networks?
Yeah, so when it comes to collaboration, it is the most important pillar for research because without collaborations, one single person or even one single group of people are, it is very difficult for them to achieve what they want. The collaborations are really important. So one of the examples of my collaborations in the projects were when I was working at DY Patil, I had collaboration with Regenerative Medicine Lab where I met Bonte sir. Then we had collaboration with Dental College from where we used to take the cells. Then I had a collaboration with Serum Institute where I'm working right now. And so, these are different collaborations. And apart from these things, also, the other collaborations were at different institutes, in other institutes, like with RCGM, we had one collaboration back then. So there were some collaborations which really helped us to go. It was not like that we didn't have equipments at the lab. In our lab also, the college had made all the necessary things available for us. But still, we need minds also. We need ideas. So we need people. And for that, collaboration is important. Now, today, when I'm working at Serum Institute, here also, we do have collaborations for almost all the projects. Like I'm taking care of type 1 diabetes project and very closely working for HPV project also. So here, like in type 1 diabetes project, it is just not our team who is working. It is just not me, first of all. We have a whole team. Then there are various things which our team is not able to handle, or we need inputs from other teams as well. So we have involved the manufacturing team, we have involved people from the QC team, we have involved the teams which are making the adjuvants. So all these teams come together. Now this is within the organization I'm talking. Now, for example, for HPV project here, I'll give you this example that for the HPV project, it was all these teams from the company who were involved. But apart from these teams also, we needed people from other institutes or other companies or other bodies. So these collaborations are always important. Without collaboration, I don't think research outputs are possible. So that's a take home message that, science is a teamwork. And that team doesn't mean 4 or 5 people, it means global collaboration, just not within the institute, within the country. It is global collaboration.
Yeah, I guess collaboration is the backbone of research.
Yes, exactly. Rightly said.
Now, as we wrap up our conversation, what three pieces of advice would you give to someone who wants to make a difference in healthcare and research just like you have?
So, three pieces of advice. Yeah, okay. So, first is hard work. Without hard work, nothing is possible. Nothing means nothing. Just not research. I'm talking about everything. Just even passing in your exams. Hard work is important. Second is consistency. Like for example, I work very hard for 1 month, for 1 year, for maybe 2 years, but after that I give up. That is not going to, lead me to the what for where I want to be. So hard work, consistency. And the third is continuous learning. Because every day there are a lot of things coming up in the market which related to our area of interest or our expert research areas. And there are so many things coming up that we need to we need to catch up with. I'm not saying that be aware about each and everything happening around. No, I am not aware about lot of things happening around me. But at least I should know the things happening in my area. If somebody is coming out with some news or if there are some podcasts available, if there are some courses available, just do it. Specifically, which are related to your courses or your research area. So hard work, consistency, and continuous learning. Be determined towards the goal and success will follow. You don't have to worry about the success.
That's a
It's a
wonderful advice.
lifelong journey.
Yes. Now moving on to the Q&A section. First moving on to that section, I request all the participants to on their camera after the Q&A session to take a nice photo. So all of them can put their questions in the chat box or you can unmute yourself.
I think I can read one question here in the chat box. Your approach to type 1 diabetes with stem cells is interesting, ma'am. My question is, what made you get this approach of stem cell therapy to type 1 diabetes, which is unique thought? We have few medications. Though we have few medications. Okay. So, type 1 diabetes is autoimmune disease, right? So, here the problem is that because of the autoimmunity, the body's immune cell kills their own pancreatic beta cells. So, there is lack of beta cell in the type 1 diabetic patients. Now, stem cell approach gives a regenerative medicine. It is basically a regenerative therapy. So, because the stem cells are having the properties of regeneration, self differentiation, and self multiplication, they will be differentiated into pancreatic beta cells and then they will multiply. So, whatever number of pancreatic beta cells are lost in type 1 diabetes, stem cells will be able to regenerate those. So, this is the approach. And we have few medications for type 1 diabetes. So basically we have the medications like antibody therapies are there are some immunosuppressants which are given, but the problem with immunosuppressants is that we make the immune system weak for the people who are given immunosuppressants. So those people who are on immunotherapy, immunosuppressant therapy, they will be more prone uh, to the infections around them. So that is the reason we thought about this, that we should regenerate the dead cells, and stem cells will regenerate the pancreatic beta cells. That's, I hope I answered your question. I can't hear you, Mayuri.
Next question is from Mohit. That is, ma'am, if possible, can you brief us about the difficulties faced in your research?
Yeah, Mohit, thanks for this question. But I guess we have discussed this. Like there were few difficulties which came up in the lab, then the antigen procurement, then budget, and all these things. So these are the anticipated and unanticipated problems which I faced. A lot many, but I think if we start listing down, Mayuri will then ask me to leave the session.
No,
So,
ma'am.
no, just joking. So yeah, I think we discussed a few. You must have joined late, or maybe I don't know, but we discussed a few things about it. Yeah. Next question.
Next question is from Satyam. Ma'am, as family fourth year student, what should we do if we want to pursue research? That is PhD in diabetes.
Okay, so you are fourth year family. So 2 more years you have, right? 6 years course it is, if I'm not wrong, family, right? So if you want to pursue your research in diabetes, initially start focusing. Like diabetes is a very vast area. There are different types of diabetes, first of all, to start with, right? So you need to focus, you need to finalize based on your interest, that which type of diabetes you are interested, whether it is type 1, type 2, gestational, or any other, whatever diabetes you are interested, you have to first finalize that. And then in that also, suppose you take type 1 diabetes, for example. Okay, now just not type 1 diabetes. It is not like you will do PhD on type 1 diabetes. That's not possible. So in that also you make a research question. So making a research question means you have to identify the problem which is going on right now, or which is unanswered by other scientists right now. So whether you want to focus on complications, like how my friend was doing back in KM, with whom I was working, then my interest started here, right? So whether it is complication, whether it is management, whether it is the immunotherapy, what kind of uh, research question is there, what kind of gap is there, you first identify that and then start working on it. But yeah, you have to be very thorough with the theory of that particular disease. Yeah.
I guess yesterday only we had that session with Ajit sir framing a research question. So
Okay.
everything has been learned from Ajit sir.
Great, great. I'm sure you must. It would have been a wonderful session.
Yes, Satyam, you can take the help of that video for framing your question.
Yeah.
Next is from Aparna. Ma'am, so stem cell therapy be helpful in type 2 diabetes mellitus as well.
Yes, it is working in type 2 diabetes as well. So there are a lot of literature research papers which are available on how the stem cell therapy is helpful in type 2 diabetes. So type 2 diabetes basically is because of the resistance, insulin resistance. And stem cells also help in overcoming insulin resistance. So yes, one of my friend Avinash Sanat, he is working on stem cell therapy for type 2 diabetes. You can read his papers. It is Avinash Sanap and Ramesh Bonde. Just put these two words, you will get a lot of papers.
Moving on to next question, that is from Arun. Ma'am, as you are doing research on autoimmune diseases and as you mentioned stem cell therapy for type 1 diabetes, what was your approach or thinking towards the treatment of other autoimmune diseases like cirrhosis, etc.?
Just a second, I'll just read this again.
Yes.
As you're doing research on autoimmune disease and you mentioned stem cell therapy for type 1 diabetes, yes. Shift was thinking of it. Okay, so you are basically the question is whether stem cell therapies will be helpful in other autoimmune disease, right? This is the gist of the question, if I'm understood right.
Yes.
Yeah. So yes, in all other autoimmune diseases also, regenerative medicines help a lot because in all the autoimmune diseases, the common problem is same, that the body's immune system is uh, targeting or killing body's own other cells. So in psoriasis, there are different targets, in diabetes, different targets, SLE, different targets. But in all these autoimmune diseases, stem cell therapy can work. There are a lot of papers about this also. Just type in Google, type stem cell therapy or regenerative medicine for autoimmunity. Then you will have all these different diseases where stem cell therapies are working. Yep.
Any more questions? If anybody wants to unmute yourself, please unmute. I guess we had finished with the questions.
Okay.
So I request all of you to on your camera so we can take a photo. Nehita, please can you take the photo? Please everybody. All of you please switch on your cameras. Yes, Nehita, once you are done, please tell us.
Yes, Mayuri.
Okay. So one more question is there from Mohit. That is, ma'am, in your research, how did you choose the sample size? As if I'm not wrong, diabetes change in different race.
You mean the sample size? Okay, Mohit, can you unmute yourself? I need to clarify the question. You mean the sample population or sample size? Yeah.
Sample population, ma'am. Sorry for the mistake.
Yeah, okay. No problem, no problem. So, sample population, basically, till now, whatever projects we have done, they are all preclinical projects, and there we have used rats and mice. And coming to the clinical population, when we target the population, so what is question? Change in different race. Yeah, okay. So when we do a clinical study, not just for diabetes only, for any clinical trial, when we have to choose the population, we have to choose the population from different sites. So even if the study is done in India, we have to take the population from all the parts of the country, like north, south, east, west. All these four regions have to be included. Then when it comes to the international trials or international studies, there also we have to choose from every continent. So it depends like which country we want to give the product or in my case the vaccine. So in whatever country we have to give the vaccine, we have to do the clinical trial in that country. And when it comes to India, when we are doing it for the first time, we have to take the population from all the four regions. So your question is valid that different diseases affect different race in different ways. So we have to study on all the race. Almost it covers all the race. When we cover all the four regions, majority of the races cover.
One
Is
more
it
question
fine?
from
Or
Arun.
yeah.
But ma'am, is it feasible for everyone to take stem cell therapy in India? Because at some points, if we are talking about antibody therapy, one major concern is the cost.
Yes. So in these therapies, the cost is involved. And that is the like right now also we have stem cell therapies for a lot of diseases, but not everybody is able to take it. So again, the cost is decided based on the physicians who are giving the therapy or the labs where the cells are made. So that is one particular reason why we want to, like, why our team is working on getting some cheaper options to reverse type 1 diabetes. Because right now also there are there is a MAB option which is available and which is FDA approved. But that antibody, that is teplizumab. That teplizumab is the monoclonal antibody which is delaying the onset of diabetes, of type 1 diabetes. But it is a very costly affair. And not everybody will be taking it, right? So first we have to analyze whether this person is prone to type 1 diabetes or not. And if they are, then it will delay the onset of the clinical stage of the disease. But it is very costly. So that is the reason we are working towards, coming up with some immunotherapy or the vaccine therapy, by which we can reverse the type 1 diabetes, new onset type 1 diabetes at a very low cost. So yeah, your point is valid. It is costly, but nothing I can do much about it because, again, yeah, one thing we can do, like if somebody is interested in stem cell studies, you can come up with a process patent for stem cells, and that process patent by that process patent you will be the charge of, then you can maybe start a startup or something by which you can then sell those therapies at a reasonable rates. So that is one thing if somebody is really interested to go ahead as for being coming up with a startup for stem cell therapy.
There is one more question, that is, how can we connect with ma'am?
Yeah, I'll give my email address here. Okay, I'll give my personal and official both. You can write anytime, no problem. Dr. Ajit is also having it, no, so you can take it from him too. But still, I'll post it here. You can see the email address, right? Yeah, you can contact me here, or one more you can contact. This is okay. You can contact on this. Yeah, this is fine.
Okay. So I guess questions are covered. If anybody has a question, please put it in the chat box. Now we can move to the vote of thanks. Thank you so much, ma'am, for sharing your experiences and insights with us today. Your journey is truly inspiring, and your journey, dedication, and insights are not only inspiring but also enriching. It's been a pleasure to hear you and your experiences, and the incredible your work doing was really a pleasure to hear you. I'm sure our listeners have gained valuable knowledge from this conversation. Thank you once again. It was an absolute pleasure to have you.
Thank you so much, Mayuri. Even I enjoyed uh, the whole conversation today. It made me think about every bit of my life, starting from my birth till now. So it was a nice, I can say a replay of my life so far. So thank you so much. And thanks a lot for inviting me over here. Thanks a lot.
Thank you, ma'am.